Okay, good evening once again. We are going to continue with the lectures on basic laparoscopic surgery course. Today, we are going to be talking on sterilization of laparoscopic instruments. It is very important we understand that generally, if instruments are not well prepared, a patient have a chance of developing postoperative infection, which could be which could manifest early or late or even as a chronic infection, depending on several factors, including the virulence of the organisms, the immune status of the patient, and several other factors, including inoculating dose. And this could be a serious challenge when instruments are not sterilized and they are used for procedure. And sometimes patients might present with atypical symptoms that will give diagnostic dilemma. So it is very important we understand the principles involved in sterilization of surgical instruments as well as laparoscopic instruments. Now, because of the peculiarities of laparoscopic instruments where you have to uncouple some instruments before adequate sterilization, it is very important you understand how to disassemble, sterilize, then assemble the instrument before packing and sterilization. And also, it is very important we understand the agents we use for sterilization and which agent is suitable for a particular type of instrument. And also, which agent will actually sterilize an instrument, not disinfecting an instrument. All these things, and for how long you leave the instruments. You also understand the type of instrument you are dealing with. Is it a critical instrument? Is it a semi-critical instrument or a non-critical instrument? And how do you sterilize this? So these are some of the objectives of this lecture for today. So the overall goals of sterilization of a surgical instrument are to prevent the break of host barrier, surgical site infection, and transmission of infection from one patient to another. If instruments are not well sterilized and they harbor a lot of bacteria, especially resistant ones, in a biofilm that is formed on the instrument, which we will discuss in due course, you will be amazed that this infection will be transmitted to subsequent patients that you will operate on. Laparoscopic instruments are of different types: complexity, fragility, immersibility, and the sensitivity to agents. So in essence, because of this difference in properties of the instrument, the cleaning and sterilization method vary from one basis on based on the instrument property. So from one instrument to another, the sterilization technique will vary based on the instrument you are dealing with. Now, it is also important you take note of specific instructions by the manufacturer so that you use a proper agent in sterilizing this instrument and not causing corrosive damage that may lead to permanent damage to the instrument, or it may even obscure vision when the optical or objective lenses are affected. So specific instructions must be considered that are usually in the manufacturer's manual. Now, before we proceed, for proper understanding of the principles involved in sterilizing laparoscopic instruments, it is important to understand some basic terms, the definition of some basic terms like cleaning, sterilization, and disinfection. Disinfection are of three categories. There's a high-level disinfection, intermediate-level disinfection, and a low-level disinfection. Then we also need to understand minimum effective concentration. Then biofilm. Now, what is cleaning? Cleaning simply means removal of debris. And of course, these debris, you can see the debris. It involves the physical removal of visible debris, such as blood, tissue, and other contaminants from the surface of instruments. It aims at removing any substance that may interfere with the sterilization process. Because if these debris are not removed, it may interfere proper sterilization of your instrument. Now, this cleaning can be done manually, mechanically using ultrasonic cleaners, enzymatic cleaners, or detergents. There are several agents that are used for cleaning. You could have a multi-enzyme detergent, enzymatic foam spray, enzymatic cleaners. Now, because of the nature of some of these instruments, you might have blood stocked in a location that cannot be easily removed. So you need an enzymatic cleaner that will digest and dissolve the proteins when they are soaked in the enzymatic solutions. You might not be able to gain access to a particular location where there is protein or blood stocked. So it is very important you understand the properties of the agent you are using for cleaning. Now, sterilization it simply means elimination of microorganisms. Sterilization involves the use of physical or chemical process to eliminate all forms of microbial life. Elimination of all forms of microbial life, including bacteria, viruses, fungi, and spores from the instrument. So all forms of microbial life are eliminated. That is sterilization. Then the next term is disinfection. Disinfection is a process that reduces the number of microorganisms on a surface or instrument. But it does not eliminate all forms of microbial life. Okay, it does not eliminate spores. So disinfection differs from sterilization in the sense that the disinfection does not eliminate spores, while sterilization will eliminate all forms of life, including spores. Now, it is very important you understand the types of disinfection. And if you understand the type of disinfection, you will know how to disinfect medical devices or medical instrument depending on the class it falls. There's a high-level disinfection. This type of disinfection kills all microorganisms except some bacterial spores. Examples of high-level disinfectants include glutaraldehyde or Sidex. Okay, Sidex is the common agent we use in the hospital. okay? We use it for high-level disinfection. However, these agents that are used for high-level disinfection can be used for sterilization. The only difference is the duration of contact with the instrument. If you are using an agent, for example, for high-level disinfection for maybe 10 minutes, you can sterilize when you now allow the contact time under specific temperature for a specific duration that is specified by the manufacturer. So that is high-level disinfection. High-level disinfection, don't forget the agent that are used, glutaraldehyde, and this Sidex, which the active agent is optaldehyde. Yes, optaldehyde. It is called OPA. Now, when you see OPA on an agent, optaldehyde, it is Sidex. It is used for high-level disinfection or sterilization, depending on the contact time. Now, for intermediate level disinfection, this type of disinfection kills most microorganisms, but may not kill some viruses. Okay. Example of intermediate disinfectant are quaternary ammonium compounds. This one is also very common. Okay, it is also very.
Measuring too much heat. You can just what's it called?
Okay, we have some noise at the background. Okay, now these intermediate level disinfectants, quaternary ammonium compound, you see ammonium in some theaters, is a quaternary ammonium compound, or phenolics. Phenolics or ammonium is a, what do you call it? Intermediate level disinfectant, okay? Now, phenolics are also agents that are used for intermediate level disinfection. Now, low-level disinfection, this type of disinfection kills some microorganisms, but may not kill more resistant organisms. For example, examples of low-level disinfectants are detergents, or commonly these are domestic disinfectants, antiseptic, Dettol. The active agent is chloroxylenol. It is an antiseptic agent that is for household use. Of course, it's used for low-level disinfection. That is cleaning surfaces. Now, these are some agents, examples of agents. If you see steriquat, most of the quat you see, if you see quat on an agent like bioquat, steriquat, they are all quaternary ammonium compounds. Ammonium, they are all quaternary ammonium compounds, and you can use those agents for intermediate level disinfection. And of course, if you want to use it for high level disinfection, as mentioned earlier, it has to be in contact with the instrument for a very long time. Now, these are some examples of some of the agents we commonly see. Okay, you can see this TCP is a phenolic agent. We said it can be used for intermediate disinfection. Savlon contain chlorhexidine and cetrimide. Okay, this is the Dettol we mentioned. And there are some various concentrations which we will explain what it means. That is the minimum effective concentration of a disinfectant. Now, this is also very important to understand what the MEC of a disinfectant is, minimum effective concentration. The MEC of a disinfectant is the lowest concentration of the disinfectant that is capable of achieving the desired level of microbial kill. The lowest or the minimum concentration of that agent that is required to achieve the desired microbial kill. Type of microorganisms, this depends on the type of the microorganisms, the factors that determine the MEC of a disinfectant include the type of microorganism. Different microorganisms have varying levels of susceptibility to disinfectants. Of course, you know, mycobacterium susceptibility will be higher than a simple bacteria. Type of disinfectant, different disinfectants have varying level of efficacy against different microorganisms. The contact time, the length of the time of the disinfectant in contact with the microorganism, and also the temperature. Now, some of these things actually work in specific temperatures that are specified by the manufacturer. Now, for optimal outcome, you have to take note of the specific temperatures that are specified. Now, the either acidity or alkalinity, the pH also determines the MEC of an agent. Now, there's a general guide that is used for quaternary ammonium compounds, quat. The minimum concentration is between 0.1 for phenolic agents, 0.5 to 0.2%, for alcohol, 60 to 90%, chloride base disinfectants, 50 to 200 parts per million, iodophos, glutaraldehyde, Sidex, they all have their minimum. Now, let us look at this commonly used disinfectant in most hospitals. Of Sidex is typically 0.5% to 0.6. Contact time is typically 5 to 10 minutes, depending on the specific outlet. Sidex, high-level disinfectant, but can also be used for sterilization. Okay, so the sterilization time for Sidex is typically Celsius, 6 hours for 25 to 30 degrees Celsius. Just spraying during a procedure, and you allow that for the instrument. However, it's a high level because there's contact time and temperature that you will achieve sterilization. So biofilm is an important concept when talking about infectivity involving surgical surfaces or wounds, community of organisms such as bacteria, fungi, protozoa on a surface embedded in a polymeric substances, EPS, organisms, which are of that prevent or disinfectants or antiseptic agent to the surface targeted for process. Now you must understand the concept of the have an effective sterilization process or its formation include adhesion. Now the first process involved is adhesion of the bacteria to the surface. Okay, it involves adhesion of the bacteria to the surface. Then there will be microcolony formation. You have microcolonies of various species, and subsequently they will form the EPS. The EPS is the extracellular polymeric substance. And when the EPS matures, they now form a biofilm that could lead to chronic infection, device-related infection, and bacterial resistance or resistance to your process of disinfection. Now, you should understand that in inadequate sterilization, disinfection of an instrument could lead to device-related infection. Now, there are some laparoscopic instruments that will have parts that are not easy to access for proper cleaning. And this could lead to the formation of this biofilm. And there could be transmission of infection from one patient to another. The patient might present with a localized systemic infection or even atypical post-operative manifestation of infection or even severe sepsis. So this is very important. Okay, then we should know that agents with enzymatic and antibacterial properties are effective agents against biofilm. As we mentioned earlier, the enzymatic agents tends to digest and dissolve proteins, okay? And it will prevent the formation of this biofilm. Now, how do we classify medical devices? The medical instruments can be classified into three categories based on their potential risk of transmitting infection and their intended use. They could be classified as critical instrument, semi-critical instrument, or non-critical instrument. Of course, when you talk about critical instruments, they are the instruments that get in contact to sterile surfaces or sterile cavities. Semi-critical, non-sterile cavities, while non-critical are those instruments that come in contact with intact skin, mucous membrane. Now, critical instruments that penetrate sterile tissue or enter the vascular system, such as surgical scalpels, forceps, and needle. Instruments used in sterile body cavities, such as laparoscopic instrument and thoracoscopic instruments. Now, of course, for this particular instrument, you have to sterilize the instrument. The minimum is high-level disinfection of the instrument, of critical instrument. Now, for those residents going for exams, you must be able to classify your instruments and know how to sterilize them, what type of cleaning or sterilization process is recommended for this particular instrument. Now, it is easier for you to classify your instrument using these three broad categories so that you can answer the question. And of course, those that are going for national exams, this sterilization process is a very common question, whether you are in O&G or surgery. It's very important. Semi-critical instruments are instruments that come in contact with mucous membrane, such as endoscope, laryngoscope, cystoscope, okay? Instruments used in non-sterile body cavities, such as sigmoidoscope or proctoscope. Even dental instruments are classified as semi-critical instruments. Now, the non-critical instruments are instruments that come into contact with intact skin, such as blood pressure use for non-invasive procedures, such as ultrasound probes and EEG electrodes. Now, environmental surfaces that are not in direct contact with patients, such as the bed rails, door handles, and so on. Now, for this, the routine household antiseptic agents we mentioned for cleaning of the floor and also surfaces that do not get in contact with breached mucosa. Now, after understanding all the principles of what cleaning is, what sterilization is, what disinfection is, okay, and the various levels of disinfection, high-level disinfection, intermediate level disinfection, and low level disinfection. You should understand the stages for high level disinfection or sterilization. Because when you use an instrument, you have to follow a specific process. Okay, you have to follow a specific process to sterilize that instrument. These are the processes you follow, but you should know that the personnel handling contaminated instrument must wear personal protective equipment, PPE, okay? Fluid resistant gown, heavy duty gloves, mask and eye protection. Now, you should know that if you have spillage of fluid on an operating table, that is the peri-op, maybe the spillage of fluid soaking the table, especially when they are using a reusable drapes, those ones that do not have impermeable layer, where the fluid that soaks the gown or the drape is also soaking the surface. That table is contaminated. Those instruments are contaminated. Because by capillarity, you can have ascension of bacteria into the instrument tray. So whenever you are using a gown to either protect yourself or a drape to lay on a surface before placing your instrument, it should be a water-resistant surface, because in most of these disposable gowns you see and drapes, you see a sterile polythene bag that is supposed to be laid on the tray before even putting all those sheets, such that even if you have spillage of your solution, it will not get in contact with the surface, so that you don't have transmission of bacteria into your field. But anytime you see them using those reusable gowns and there's soilage or spillage of fluid, you have high risk of contaminating your instrument. Now, let us go through the steps of sterilizing all these instruments. The first, and this is not only for laparoscopic instruments, it's for all surgical instruments. Now, assembling and disassembling of instrument. Now, whenever you see a peri-op sterilizing their instrument or preparing their instrument for sterilization, they usually pack similar instruments together. Okay, they assemble all similar instruments together, not haphazardly, before they begin other processes. All the trocars will be assembled, all the artery forceps will be assembled, all the telescopes will be assembled together. Okay, they are all arranged into different categories. Then there are some instruments that requires uncoupling. You have to uncouple them so that your agents for disinfection can reach different spots or parts of that instrument for disinfection. Then the next step is pre-cleaning. Now, there's a difference between pre-cleaning and cleaning. Pre-cleaning is removal of debris immediately after use of that instrument so that it doesn't dry on the surface of the instrument. So physical removal of the debris. Immediately the operation is done, you see them cleaning off the instrument with gauze or something before taking them for proper washing with agents, cleaning agents and disinfectants. Now, after cleaning, they will now dry to avoid spots of moisture that harbors proliferation of bacteria, you have to dry them. Okay. Now, you should make sure that there are no crust of blood. It's not acceptable when you are coming for another procedure, you are seeing a crust of blood on the instrument you are about to use for another patient. Okay, that means that instrument was not properly cleaned before disinfection. And don't forget, we said if an instrument is not properly cleaned, it will interfere the sterilization process. And once a biofilm is formed, penetration of the surface of the instrument might be very difficult, which will carry a very resistant bacteria. Then high-level disinfection. So let us look at this individually. Now, for pre-cleaning, we mentioned that it's involved the immediate removal of gross debris, such as blood, tissue, and other contaminants from the instrument to prevent drying of the debris. Pre-cleaning prevents the drying of debris on the instrument, making it easy to clean and reducing the risk of instrument damage. It's typically done at the point of use. Now, cleaning involves the removal of residual debris, including microscopic contaminants from the instrument. Of course, this uses detergents and water or other cleaning agents. Prepares the instrument for sterilization or high-level disinfection. Cleaning prepares the instrument for sterilization or high-level disinfection by removing any remaining debris or contaminants. Now, after these first two processes, then you have to dry. And drying the instrument must be dried to prevent water spots and bacterial growth. Now, high-level disinfection, we already defined all these. High-level disinfection of laparoscopic instrument is a critical step in preventing the transmission of infection and ensuring patient safety. Now, soaking in disinfectant solution. You see, after that drying, you have to soak. Laparoscopic instruments are soaked in a disinfectant solution, such as glutaraldehyde or tophthaldehyde, which is OPA, that is Sidex, for a specific period. For glutaraldehyde, 2.0 to 3.4% solution for 20 to 45 minutes. That is for high-level disinfection. And we mentioned for 12 hours at specific temperature, you get sterilization. Now, Sidex is 0.5% solution for 5 to 10 minutes. Then hydrogen peroxide, 75% solution for 20 minutes. Now, there are various types of sterilization. Okay, there are various types of sterilization. There's this steam sterilization. Now, you should remember, not all these instruments are heat sensitive. There are some instruments that are heat sensitive. There are some that are not heat sensitive. You cannot subject all your instruments to steam autoclaving. So that's why there are various types of sterilization methods. Steam sterilization uses high pressure steam to kill microorganisms. It's effective and efficient, but may not be suitable for instruments with sensitive material. Then ethylene oxide sterilization uses toxic gas to kill microorganisms, effective for heat sensitive instruments, but it requires aeration to remove residual gas. Now, there are specific devices that are used for aeration after exposing this instrument to ethylene oxide gas. Hydrogen peroxide gas plasma sterilization uses combination of hydrogen peroxide gas and plasma energy to kill microorganisms. Now, effective for heat-sensitive instruments and has shorter cycle time than ethylene oxide gas. Then dry heat sterilization, use hot air to kill microorganisms. You see some of these instruments are left in hot oven, not autoclave, and for some specific duration of time at certain temperature. And sometimes they are even taken directly from the oven to the operation tray. Now, after sterilization, you have to confirm by quality control and validation. You see there are some markers that are placed on these instruments that denatures or they change color to indicate that the sterilization process have been achieved. So they are indicators for quality control and validation. Now, there are biological indicators. Now, you should know some of these indicators are used to monitor the effectiveness or verify effectiveness of the sterilization process itself, while some agents to verify the sterilizing agents, then you also monitor the process. These are the three processes that are involved in quality control and validation. Now, biological indicators are used to verify effectiveness of sterilization process. Then chemical indicators are used to verify presence of sterilizing agent. Then the process monitoring. The sterilization process is monitored to ensure that the correct temperature, pressure, and time are achieved. Because all these things, even the autoclave machine for specific instruments, they have the required temperature, the pressure, and the timing. You need to set all these things to achieve sterilization. After sterilizing this instrument, you need to store them appropriately in an environment with appropriate temperature and moisture. If not, at storage, it will be contaminated. After sterilization, laparoscopic instrument must be stored and handled properly to maintain their sterility. Now, the storage instrument must be stored in a clean, dry area, away from direct sunlight and moisture. Of course, if there is moisture, there is tendency for contamination. Now, handling. Instrument must be handled carefully to prevent damage and contamination. Now, in the CSSD, Central Surgical Service Department, the temperature, the ideal temperature is between 18 to 25 degrees Celsius and a humidity not more than 70%, and at least 4 air exchange per hour. And of course, first come, first to leave. The instruments that are brought earlier are the ones to be taken out first, so that you don't have instruments staying for a very long time in the sterilization unit. Now, there are some specific instruments that need special handling, like the camera head. We've already discussed all the parts of a laparoscopic instrument. You can refer to the previous lectures we did. Now, some of these camera head are autoclavable and some are non-autoclavable. And if they are autoclavable, it will be indicated. Now, newer devices are autoclavable. Okay, you'll see some newer devices that even have lenses, but they are autoclavable and it will be indicated maybe by having a gold strip or tape on the camera head, like the Olympus product with gold tape or plates are autoclavable. Now you have to be very careful not to go and autoclave a non-autoclavable camera, because you are going to destroy the instrument. That is you have to take serious precaution. Then should not be soaked in any solution, because this can cause damage. Now, camera heads are not soaked in solution. If they are non-autoclavable, you have to clean them with disinfectants for a high-level disinfection. Now there are some spray we use for high-level disinfection, like the Sidex spray. You can spray and allow for 10 minutes, then you clean off the Sidex, or you can use ammonium to clean. Okay. Now, but the gold standard is to clean, then you apply a sterile camera sleeve. There are long polythene transparent bags that comes in a sterile manner that is sleeved through the camera head and the cable. So the surgeon will now be handling the sleeves now rather than holding the camera directly. So that is the gold standard. So even if you use a low-level disinfectant, maybe using spirit, methylated spirit to clean, or using povidone iodine to clean, you can just pass the camera with the cable through a sleeve. Then the surgeon will now be handling the instrument through a sleeve. Now, the light cable, of course, is a fiber optic glass bundle. This, which makes it very delicate. You know, the fiber optics, if you mishandle them, you damage the fiber optic cables inside the fibers inside the cable. So it is held in a circular manner. Don't kink to form an acute angle. And the diameter, when you are packing it, you have to hold, fold in a circular manner with a diameter of greater than 15 centimeters. You don't just bend them acutely, you will destroy the fiber optic cable, and there will be spillage of light. And when you have breakage of the cable, the intensity of light that is going to be transmitted into your view will be reduced. And of course, the principle of laparoscopic surgery, the lesser the light transmitted into your operation field, the lesser the view you get. You get a less clearer view. That's why telescopes of lower diameter transmit less light than telescope of larger diameter. We've mentioned all this in the classification of the instrument. Now, handling and cleaning of the telescope. Now, you know, when you are cleaning this telescope, you should know that some of these agents are very slippery. If you just apply the cleaning agent on this telescope and hold carelessly, it may slip off your hand, and when it falls on the ground, it will damage the lenses. So you have to hold the ocular lens facing your palmar surface so that you can you can grip it properly, not gripping the shaft. Don't hold the shaft, because the shaft, you can see, is a slippery surface, silver surface, that with the cleaning agent, it can slip off your hand. But if you hold the ocular lens on your palmar surface, you have a better grip. There you now clean properly. The pre-cleaning with enzymatic detergent immediately after use, so that these agents, blood or tissue products don't stick to the lenses. Okay, and you have to pay attention. You know, we describe the telescope as having the ocular lens, the objective lens, and the light funnel through where the light source is transmitted. So you have to pay attention to these parts to clean properly. And you have to ensure you are using agents that are recommended by the manufacturer, because if you use agents that will cause crack or blurring of the lens, you may have a very poor vision. Or agent that may be causing clouding of the lens, it may affect the vision of the of your instrument. Now, you have to routinely inspect your instrument before and after use for proper visual quality. So in conclusion, you must understand the principles of sterilization of surgical laparoscopic instrument generally to prevent transmission of infection, all forms of infective complication that may present either as an apparent complication or that may present with serious systemic complications with diagnostic dilemma. So today we are going, this is the lecture for today. Next week, we are going to talk about the principles of ergonomics in laparoscopic surgery. So if you have any question, please, you can unmute yourself and ask, or any comments or contributions. Thank you everyone for participating. So any question, please, you can go ahead. Any questions? So it appears there are no questions.
Hello.
Hello, sir. Good evening,
Good
sir.
evening. How are you?
Fine, sir. You are welcome, sir, for joining us.
Thank you very much.
You are welcome, sir.
Well, it's okay, maybe I should take it from these agents
Yes, sir.
that are used. It's just an observation. These agents that are used uh for sterilization, cleaning, and whatever.
Yes, sir.
Some of them have specific uh concentration on the sachet, on the packet, and whatever.
Yes, sir.
Now, how do you maintain those specific concentration? And also, if I stretch it further, how do you maintain specific temperature for so long as time as 20 minutes, 15 minutes, 30 minutes? It means there is a need for keeping an eye on some of these things. For example, if it is 0.5%, as it were, and you have this concentration of um, the agents, I believe there will be dilution.
Yes.
That will mean the fellow in charge, you have to maintain specific dilution ratio to be able to keep that dilution constant. Or, for example, if you have a jar of Sidex, what ratio of Sidex at that level will be mixed with water, as it were, with what solution? Because those are the details that somebody can just ask in aura to
Yes.
find out if you have been involved in some of these things.
Yeah.
This now leads me to the other part of my observations and questions. These instruments are treated like babies in the hands of the surgeons. Like a general surgeons, you finish with a thyroidectomy and whatever laparoscopic, you just give the rest to the peri-op people and you turn your back. In laparoscopic, thoracoscopic, using these fine and very, very delicate instruments, you don't turn your back like you will turn your back on ordinary artery forceps, clamps, retractors. That's one of the things I really want to point out. All these laparoscopic instruments deserve your attention, as it were, as the user, so that you don't just treat them the way you will treat an ordinary surgical instrument. I hope you are hearing me.
Yes, sir. We can hear you, sir.
Aha. So because in orals, you may get into some of these things and you need to discuss. So you will need to know, to convince them that actually you've been part of these things and you know exactly what to do. That's for the residents and co. Thank you very much for a beautiful presentation.
Thank you very much, sir. All the residents, you took note of the comments and some specific details that was raised by Dr. Eleta. Dr. Magaji, I can see few of the residents have left the meeting. Dr. Uju, Magaji, are you with us?
Yes, sir.
Yes, those going for exam. I did not see Usman. I did not see Abimuku. Dr. Uju, are you with us? So that is a very important observation that was raised by Dr. Eleta. You know, some of these agents come in powdered form. In fact, this is a very practical question. Some of these disinfectants come in a powdered form with specific concentration, and the instruction of the quantity of water for dilution will be mentioned to get specific concentration. So this is a detail that if you have not used this agent before, you might not be aware. Not that, don't think that all of them come in a diluted form. Of course, you see some of the ammonium, you see some of the Sidex will come in an already diluted form with the concentration mentioned on them. But some will come as a powdered form, and the instruction will now be mentioned on how to get specific concentration. Because you might want to get a higher concentration for a shorter duration to achieve sterilization. You understand? Then a lower concentration for a longer duration to achieve sterilization. So you have to prepare this solution yourself. So you have to be aware of that. Thank you very much, sir, for that observation.
Thank you. You're welcome.
So the resident, do you have any question, any clarification? Dr. Magaji, any question?
No question, sir.
If you don't have question, I'll ask you question. What is sterilization? Yes, you should be spontaneous. Magaji.
That's the process of cleaning organisms and dispose on an instrument.
No, you have to give a complete definition. You know you are going for exams. So you are going for exams. So you must mention all these definitions the way they are. You understand? So after the lecture, you have to go back. I'll forward the slides. You go back and review the matter. Sepsis, asepsis, sterilization, all these antiseptic process in surgery, they are very important. You review them. So thank you very much, everyone, for attending. In the absence of any other comment or questions, we are going to end the presentation here. Next week, we are going to discuss ergonomics in laparoscopic surgery. And we are going to commence the practical sessions in the dry lab, possibly first week of next month. So I'll encourage all those who are yet to acquire their trainer boxes to do that. But we have 2 trainer boxes that are donated by Medtronic company. I think that will not be sufficient for those who have not procured theirs. now. So thank you very much all. We are going to end the meeting.
Sorry, Dr. Bashir.
Yes, sir.
Yeah, I wouldn't mind a copy of the last session on the laparoscopic instrument.
Okay, sir.
The
I'll
one that
send them.
different parts and whatever.
Okay, sir.
Okay,
I'll
thank
send
you.
all the previous lectures to you, sir.
Okay, thank you.
You're welcome, sir. So thank you very much all and good night. Have a wonderful weekend, sir.
Thank you. Good night.
Good night.
Thank you, sir.
Thank you.